Welcome to our guide on postoperative care following dental extractions. It's crucial to follow these instructions to ensure a smooth recovery and minimize complications. Let's start with some essential tips to protect the surgical site. Protecting the surgical site: avoid stretching your lips with your fingers to the surgical site, as this can cause trauma and introduce bacteria. Keep your head elevated at all times, even during sleep, by putting two pillows behind your head, ideally for the first week. Replace gauze every 20-30 minutes until bleeding stops. It's normal to spot blood for the first 24 hours. Do not eat, drink, or sleep with gauze in your mouth to prevent choking hazards. Contact the office if bleeding is extremely heavy or continues for over 24 hours. Do's and don'ts. Do not swish or spit aggressively for the first 24 to 48 hours, as we want to maintain the blood clot over the healing site and avoid dry socket. Do not floss in the surgical site for 3 weeks after surgery. Continue normal flossing in all other areas. Do not water pick for 3 weeks on the surgical site. Do not drink alcohol for 1 week, as it can interact negatively with medications. Do not smoke or vape for 5 to 7 days, ideally longer, as this can hinder healing. Do's: if Stella Life Recovery Pack was given, use as directed on the side of the box. If chlorhexidine was given, use 2 to 3 times a day for 1 week. Stop after 1 week, it can stain teeth. Use a soft post-op brush only on surgical site, starting the morning after surgery. Brush only the teeth and not the gums in the surgical site. If using a water pick, resume use after 3 weeks at the lowest level and continue increasing power over time. Continue normal brushing in all other areas with your standard device. Resume normal brushing on the surgery site with your standard toothbrush device after 1 week. Discard your soft post-op brush after 1 week of use. Sutures will dissolve on their own within 1 to 4 weeks. Swelling: use ice packs externally around the surgical site for 20 minutes on and 20 minutes off for up to 72 hours, at least 4 hours a day, with the first day being the most important. Do not place ice packs inside the mouth. Maximum swelling and bruising occurs 72 hours after surgery and improves from there. Bruising can have various colors and may travel down the neck or up the cheek as it heals. If swelling or bruising persists after 72 hours, switch to warm compresses instead of icing. Medications: antibiotics. Complete the full course of antibiotics if prescribed. Discontinue if you develop hives or a rash and contact the office immediately. Pain: expect pain or discomfort after surgery. Follow prescription instructions for pain medications. You may take the narcotic and Motrin together if prescribed. Rest: get adequate rest. Avoid strenuous activities and heart rate elevating activities for 3 to 5 days, as this can spike your blood pressure and delay healing. After the first 72 hours, you should start feeling better each day. Avoiding dry socket: avoid spitting forcefully, using straws, or actions causing negative air pressure, for example, whistling, vaping, and smoking for the first 2 weeks. This can dislodge the blood clot, causing a dry socket. Dry sockets are painful and hinder healing. Contact us if you suspect one. Things to be aware of during your healing process: infection. Signs of infection may include increased swelling after 72 hours following your surgery. Membrane exposure. After 4 to 6 weeks, notify us if you see the white membrane exposed, used to protect the bone graft, on your surgical site. Bony edges, granules. After tooth extraction, you may feel hard, sharp projections. They typically disappear in a few days or a few weeks. For bone grafts, you may feel loose bone particles. This is normal in most cases. Temporaries, if applicable. If you have a temporary tooth, inform us if you feel pain or pressure from the appliance in the surgical site. Additional adjustments may be necessary. Retainers. Bring your oral appliance for necessary adjustments. Appliance should not apply pressure on the surgical site. Simplified diet. Dietary suggestions following surgery for the first 14 days. First 24 hours, consume cold or room temperature soft foods only. After 24 hours and up to 14 days, introduce lukewarm, mushy foods. Avoid nuts, seeds, berries, crunchy foods, and hard bread for 1 week. Minimize extremely spicy and acidic foods. Chew on the opposite side of the surgical site, if applicable. Do not use a straw until your post-op evaluation. Thank you for watching our post-operative instructions video. We hope you had a wonderful experience at our office. For further inquiries, please contact us.